Hello, everybody, and welcome to another episode of the Abundant Wellness Podcast. Today, we have the privilege of having Dr. Elisa Song here with us today, talking about not just about her book, Healthy Kids, Happy Kids, but really talking about integrative wellness for our children and for ourselves too, because I think as parents, oftentimes when we start to recognize these things that are happening in our children, it does something inside of us that kind of motivates us to take different care of ourselves. The reason I said different is that should be better, but we take care of ourselves differently when we know how to do that. So I am such a huge fan of your work. I've been following you for years and years and years. And then your book came out and I knew that I had to get you on the podcast. So thank you so much for being here today, Dr. Song.
Oh, well, I'm an honored to be here. We were just talking offline about how, I was listening to some of your recent episodes, and I love the work that you're sharing, and it is so important. Especially for parents who we just want to know that we're doing the right thing for our kids, right? We just want to know and
Absolutely.
trust that what we're doing is that it's based in research, and also that it really will make a difference for our kids.
Absolutely. And, I think we share some common ground, both of us trained in pediatrics. I spent almost 15 years in pediatric acute care, PICU and NICU before I left the hospital environment. But I know that my listeners want to hear about you and your background. So, would you mind sharing with us a little bit about that? And then what kind of nudged you into integrative medicine?
Yeah, a lot of functional medicine integrative practitioners will, especially those who have taken the leap from conventional medicine, right? It's one thing if this was always, the path that you were going to take, but a lot of integrative practitioners from the conventional world really moved into this field because maybe they had their own health crisis or a family member had their own health crisis that conventional medicine didn't have all the answers for. And,
Right.
I mean, knock on wood, that wasn't my story. My story really is one of, this was something that I think, I just always was called towards. And,
Hmm.
I remember in high school thinking about, oh, what would I want to do with my life? And I was heading off to college at Stanford. Being a doctor was the last thing on my mind, right? I mean, I knew I always wanted to work with children. So I thought
Hmm.
maybe a teacher. I landed upon becoming a lawyer, and I was going to be a children's rights advocate. I was a public policy major. I was going to be on Capitol Hill fighting the good fight for our kids. And I was really passionate about that. And through this all, I was really interested in spirituality and what we would now call mind body medicine. It wasn't quite called that
Yes.
back then because this was now in the late 80s, right? And I just, as a junior, I stumbled across this flyer, on one of those telephone posts, and it was a conference of the American Holistic Medical Association, and I was what is holistic medicine, right? I'd never heard of it because my
Yeah.
mom was in a very conventional OBGYN growing up. I mean, I had so many rounds of
Okay.
antibiotics for like every cold, every whatever,
Right.
right?
Yep.
So, and yet my grandma, lived with us and she's Korean and in as is the case in many other cultures or traditions of using herbal teas and, herbal
Yes.
broths and tinctures, right? So I still grew up with that, right? But anyhow, I went as a junior. I was all of maybe 20 years old and I'd already taken the LSATs and I sat in at this conference and I heard from people who were just starting to get known, like Andrew Weil and Deepak
Okay.
Chopra, right? And
Mhm.
Joan Borisenko. And I mean, my mind was blown. I mean, at that point, I remember calling my mom. We didn't have cell phones back then. Landline, called her.
Yep.
And I said, Mom, I think I want to be a naturopathic doctor.
Whoa.
Right. And
Mhm.
mind you, this is now, almost a little under 40 years ago, right? And
Mhm.
and she's like, "What is that?" And nobody ever discouraged me, but nobody also ever said, "Yeah, that's the way to
That's
go."
the thing, yeah.
Yeah, so I hesitated, and a lot of people were kind of telling me, "You know what? If you wanna do that, maybe go to medical school first, and then you can figure it out." So that's the path I took. I'm forever grateful for the path that I took, but it was
Yeah.
really, throughout medical school and residency at UCSF, it was always with this, "What can we do differently?" And,
Yes.
same thing right after residency when I thought to myself, oh my gosh, I really don't wanna be a doctor because
Yeah.
I didn't see anything that I didn't wanna be a
Yes.
hospitalist, I didn't wanna work in the NICU or the PICU, I didn't wanna be in primary care where you're seeing one patient every 10 minutes. And
Yeah.
again, just life gives you the lessons you're meant to learn if you're open to it. And, just as I was thinking, I'm going to go back to my advocacy roots and, maybe I will go back and get a law degree and do all that.
Mhm.
I stumbled across another flyer, and this was a food as medicine conference. And this was
Oh, nice.
yes, and this was in the late, you know, gosh, when was that? It was in the late 90s. Okay.
Okay.
And again, I thought, well, why not? What is this concept of food as medicine, right?
Mhm.
What we eat actually matters. And so I
Yep.
went and I heard a very young Mark Hyman
Okay.
talking about functional medicine, and I was like, "Whoa, this is mind-blowing that we can actually change our, genetic destiny, right? That we
Right.
don't have to say, "Oh, it just runs in your family," that we can
Right.
shift what's happening and our outcomes for ourselves and our kids. And so that was that when I dove into functional medicine, and then I thought, well, functional medicine has some answers. What about other modalities? Let's stay open to that. So I learned
Right.
homeopathy and herbal medicine and essential oils. And when I opened up my practice in 2004, 20 years ago, it was as an integrative functional pediatric practice.
Wow.
So, I mean, I'm
That's
blessed.
amazing.
I haven't practiced any. I mean, I'm some of my friends definitely, my pediatric colleague friends, they definitely looked at me kind of sideways and
Of course.
but I have been very fortunate because they 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 knew me. They knew that I wasn't just some like go off to some fancy new shiny thing, that I
Yes.
really wanted to be grounded in research and evidence. And so they kind of, I mean, what's the right word? They were kind of amused by my
Yeah.
interest
Sure.
and very tolerant, right?
Mhm.
Um, and now, so many colleagues are, referring patients to me saying, "Wow, you've really opened my eyes." And, especially with the book that I just wrote, I mean, being able to write everything down on
Yes.
paper with the research and also with the practical clinical know-how. I think it's really helped a lot of parents and practitioners who are open, but maybe kind of on the fence or maybe already into holistic
Right.
care, but really want to know, okay, from a pediatric standpoint, how do we really dive in? That's
Absolutely.
been a blessing because then I don't have to say it to everybody, right? They can just read it.
Right. Well, no, and I was just thinking, I mean, first of all, your story is amazing, and I love everything about it because it is hard to find, at least in our area in Washington. I think it varies by region a little bit. It can be really hard to find a practitioner who is willing to pull in all of the pieces. Like there are times where we need conventional medicine,
Yes.
100%. And we have to be critically, I mean, this is what we're taught, like in nursing school and in medical school, to think through the risks and the benefits. But that means we need to be thinking about that for every modality, not just
Yes.
conventional medicine, right? And so, what I found, one of the challenges is finding a pediatrician like yourself. Like I've found naturopaths up here, but maybe they're not as well versed in pediatrics. And so they have a harder time with, okay, well, if we give herbs, then what's the dosage? And if we do
Yes.
homeopathy, then there's all of this. And so I love your book because it is all of that. And it's not saying don't go to your doctor and don't work
Mhm.
with your doctor and you can do everything yourself, but it is creating a more well-informed parent.
Yes.
um, and I think that's huge because as you know, with any practice, you reach capacity for how many people you can individually see on your own, unless you're training more people to be like you, right? Which
Yes.
which hopefully we're all doing. But I love your story because, a little bit about mine. I was already immersed in conventional medicine, but a little bit, it didn't take me long to get kind of dissatisfied with it. And by that, I mean, I was already thinking in my head with a lot of cases like, huh, I wonder if Like, that was the common thought going through my head. I
Yes.
wonder what would happen if, which is how all science starts, right? It's the hypothesis. I wonder what would happen if. And realizing when I started researching, oh, the research is there for a lot of
Yeah.
these things. The
Yeah.
research is there for vitamin C therapy when we wean somebody off a ventilator. The research is there for introducing probiotics instead of antibiotics. Like, and yet there was so much resistance
Mhm.
in, and still is, in the medical community. So that eventually just kind of, I realized I didn't want to be in that kind of environment
Yeah.
anymore. Like, it has its place, but I'm like, I have the skills, I have the know-how. Let's get the training and fill in the gaps for people, which
Yeah.
is, exactly what you're doing. So I want to kind of touch on I was like mesmerized by chapter 1 already. I'm like, "Oh my gosh, this is so good." I haven't gotten through the whole thing. I'm going to be totally honest with you. As you can see, it's like pretty new, but I was so rocked by chapter 1 that I'm like, we could like do many episodes just on that first chapter,
Yeah.
because I think what it does is it kind of has captured where many parents are, whether you're a clinician or not. This, like, why is my kid constantly getting sick? Is it normal? Like, am I tolerating things I shouldn't be tolerating? I can't even tell you. I'm sure you can relate to this. How many clients come to me that are saying, yeah, and my kids had eczema for 5 years, and the doctor just says they'll grow out of it, or they just need more steroids. So let's talk about redefining normal, because I think as practitioners and as parents, we're accepting a lot of things about our children's health and their behavior that isn't actually normal.
Yeah.
So, were you clued into that from the very beginning of your integrative practice? Like, your eyes were already on, like, let's address these
Mm.
big issues? Or was it a particular client that kind of flipped that switch for you?
That's such a great question. I actually haven't thought of that in those terms. And I wanna back up a little and say I love that you mentioned that the work that you and I do, the goal is to create a more informed parent, a more informed child and teenager,
Yep.
right? And
Mhm.
also a more informed practitioner. Because I've
Yes.
had, countless practitioners read the book, and the same thing, I have one section that says, "What I wish I had learned in medical school."
Yes.
Right?
Yep.
And it's like this, I mean, it's sort of like this aha light bulb moment and also like a gut punch at the same time,
Right.
right? Where you're like,
Mhm.
"Oh my god," right? You're
Yep.
going back and like ticking through all the patients that you're like, "Oh, I wish I'd known this," right? Or
Oh
if
my
you're a
gosh, yes.
practitioner with children, you're like, "Oh, I wish I'd known this," or like a mom too, right? If you're on your 2nd or 3rd kid, you're like, "Wha," or a great, I've had grandparents say, "I wish I'd known this for my own
Yes,
kids, but at least now I know
totally.
it for my grandchildren," right? And
100%.
we have to just sit just like, the path that led me into this. The lessons come at the moment when you're ready to receive them, when the time
Right.
is right. I mean, we're on this journey for a reason, and so we can't ever look back um, with guilt or regret. We do anyway.
Right.
I mean, that's just the
Yeah.
mom life, right? I
Yeah.
mean, it just
Right.
happens, right? Um,
Yep.
but the other thing, that I would say is, as a practitioner and as a mom, when I was first really kind of, having all these light bulb moments of like, oh my gosh, this is how the conventional medical system is failing our kids, right? They're not, it's
Right.
band-aid medicine, it's not helping our kids thrive. And wow, look at all of these unintended and adverse, potentially lifelong impacts of our medications that we're using, like steroids and antibiotics and reflux
100%.
medicines. So at that point, I was not a mom yet, but I was a
Okay.
practicing a pediatrician. And my first instinct was, I'm not touching pharmaceutical meds anymore,
Mhm.
right? That was my
Yeah.
first like, wow, okay, look at the harm that acetaminophen does and
Right.
ibuprofen. Okay, let's always choose the natural way first, and let's try to avoid medications at all costs. Now, I
Right.
think all parents go through that, when they're finding this. Same thing with
The pendulum
practitioners.
swing.
It's a
Yeah.
pendulum swing, right? And then you have to kind of come into the middle. And as I was, at the chair of A4M pediatric education. A4M is one of the largest functional medicine practitioner training organizations.
Okay.
And as chair of pediatrics, I, I mean, oh my gosh, what a dream. I get to um, teach and bring world-class experts to pediatric practitioners who want to learn more, whether they're starting out or whether they're more
Awesome.
seasoned, right?
Yeah.
And that was a question. One of the questions was, how do we avoid the medications? And I said,
Mhm.
let's just stop for a moment and have a mindset reframe, right?
Mhm.
It's not that medications are all bad or all good, and we can apply the same to natural therapeutics,
Right.
right? There's nothing that is inherently good or bad. It's the context in which they're taken and how we use them. And we should consider pharmaceutical medications as part of our toolkit, right? If that's something that
Right.
you prescribe or even work with an MD who or a DO who does prescribe. These are our tools. And when we have an expanded toolkit with not just prescription meds, but with herbals, homeopathics,
Right.
essential oils, Ayurvedic, Reiki, whatever modality that you use, it gives us more of a chance to really help our kids from the inside out and uncover all the factors that they
Yes.
need to stay well and or get well. And so that's one thing. And I would say, what was my kind of aha moment on the state of kids' health? Well, I was at UCSF from 1997 to 2000. And I mean, it's a tertiary coordinary care system. I mean, we see the
Yes.
sickest of the sick, and so I'm going through, and I was in my developmental pediatrics rotation. Okay.
Mhm.
And there was a Center for Autism at, Langley Porter, which was a psychiatric unit, psychiatric arm of UCSF, and we kind of rotated through, I think maybe for a few days, and I remember my attending telling all
Mhm.
of us, or three of us who were rotating together, and he looked at us and said, "You know what? So you just saw one child with autism. If you see a handful of kids with autism in your entire career, that's going to be a lot." Like, I
Wow.
clearly remember him saying that. And then
Whoa.
fast forward, so that was 2000. In 2004, I opened up my practice as a functional medicine pediatrician. I had trained
Yep.
as what's called a DAN, doc, defeat autism. Now we don't call it that anymore,
Yeah.
because that acronym belongs to the Divers Alert Network.
Okay.
But I learned how to apply functional medicine to kids on the spectrum and neurodevelopmental concerns. Open up my shingles thinking, "Oh, I'm gonna see a wide variety of kids with chronic health concerns or well kids whose parents want a different approach." Flooded with kids on the autism spectrum.
Wow.
Flooded. I mean,
Mhm.
I couldn't believe it. And, it's not that over 4 years, all of a sudden there were a lot more kids. These kids, were and parents were, I mean, desperate for answers to help reduce the really problematic symptoms of
Yes.
autism, and
Yes.
to enhance their
Totally.
language and communication, help them feel comfortable and in their bodies and their
Yes.
brains. And so that to me was like, wow, what else is under the
We
surface? And
missing.
yep.
Yes.
And then just at that point in 2005, the New England Journal of Medicine published a report. I was barely not even a year into my practice. And it was an article noting that for the past, decades, centuries, life expectancy has improved, right? Medical advances
Mhm.
had made it such that lifespan was improving. And yet, we were at a point that for the first time ever in history, our children were expected to have shorter lifespans than us, their parents,
Yep.
almost all due to diet and lifestyle related diseases.
100%.
Right. And through the
Absolutely.
pandemic, we know, I mean, I had never heard of NCDs before. I mean,
Mhm.
a lot of us learned a lot of new lingo during the,
Right.
we're like, what is that? Right.
Mhm.
And so through the pandemic, um, what the World Health Organization noted is that NCDs, non-communicable diseases, were really the leading risk factors besides elderly age for COVID morbidity and mortality. And now we
Right.
know 7 to 8 people worldwide die of NCDs, not
Wow.
infectious disease. They die of non-communicable diseases. What are
Yep.
those? heart disease, diabetes, cancers, metabolic, problems, type 2 diabetes, which when I was in
Right.
residency was not called type 2 diabetes. It was called adult onset diabetes.
Right.
And we had to change that because all of a sudden these
It's
kids.
not just adults, it's
That's
kids
right.
too.
That's right.
Yep.
So, and then on the flip side, because I also think, when you're on Instagram and, following lots of, I mean, influencers, many of whom are my friends, right? But you can scroll through and think, oh my gosh, as a parent or as a practitioner, how can how can kids thrive today? How
Yep.
can my own kids thrive? We live in such a toxic world.
Right.
So, yes, we take a moment to recognize that. And then we also need to, again, it's a mindset flip. We have to
Right.
go, so we can't avoid everything. These forever
Right.
chemicals, they're here to stay. But there's so much in our hands and by
Absolutely.
that virtue, our children's and our teenagers' hands that we do have power over. We do have a say over. And that's what we want to focus on.
Absolutely. Yes. And I think I love that you kind of landed there because I that's was my next thing was going back to that creating a more informed parent usually creates a more empowered parent, which means that when my child is sick, I'm not having that like knee jerk, I have to
Mhm.
get them into urgent care, I have to put them on antibiotics. Yes, maybe, like always use wisdom and discretion and getting them checked out appropriately. But like you said, I can make them chicken broth. I can make sure that they're well hydrated. I can make sure that they're peeing, appropriately. I can make sure that that they're as comfortable as they can be, or that I am learning to be comfortable with a decent fever.
Yeah.
I will never forget, my oldest daughter has pandas and she is like 99% recovered from it. But we actually had a party when she had her first fever because
Yes.
her autoimmune response, she never had normal symptoms to illness. And so when she finally got like a 101 fever, I was like, yes, I took a picture of it because I'm like, this is a healthy, like she's got snot, she's coughing, like this is what we want. We don't
Yes.
want neuroinflammatory symptoms. We want symptoms. And I remember when I first started working with a naturopath, who actually he was a geneticist that then became a naturopath. So he had a little
Wow.
bit of, yeah, it
Yeah,
was it
that's
was
so
so
cool.
fun. I loved just like learning from him because he was so smart. But one of the things he told me was he's like, Andrea, you've got to stop avoiding illness. Like illness is
Yes.
good for you.
Yep.
And he's like, everybody needs a good illness. Once a year, you need a good fever that knocks you out for a couple days. And I still don't like that, but I do think he's right on in some level. So I think part of it is learning how to be comfortable as a parent in recognizing like what's normal, what's not normal. How can I create kind of this environment in my home that this is the, like you said, we can't control everything. I now have a teenager. I'm learning that in a different
Oh,
way,
yeah.
like
Yep.
a toddler with more words, right? And a little bit more power. Um, but what I can control in my home, I want it to be nourishing, right? I want it to be sustaining those goals. If I don't want my children to be that statistic that they don't outlive me, right? Then there are some things we're going to have to change.
Yeah.
And I think that is really hard for us as a culture to move away from, right? Because like I grew up on standard American diet. It's probably why I had all the issues that I had, chronic ear infections and strep infections and all of those things that we just kind of normalize. So, what would you say? Maybe normalize isn't the right word. Maybe we can come up with a different word for that. But what would you say when it comes to redefining normal? When what would you say? I'm trying to get to my question. Are parents accepting as normal that we should not accept as
Yeah.
normal? Like,
Yeah.
if you could just, because I know you talk about some of those statistics in the book, but if we could just like spitball a couple of those, what
Yeah.
would you say?
Yeah, I mean, I think, nowadays, and I think back to my childhood, and I
Mhm,
remember in elementary school, what stands out really clearly to me. I remember this one kid, and really sweet kid. I mean, just the nicest little boy, right? And he was in my class. And what stood out that was so unusual back then was that he had this inhaler.
mhm,
that he would take before PE, and we're
Okay.
all fascinated as kids, like, "What's that?" Right?
Yeah.
Now, I jump forward to I mean, my kids are both officially teenagers now. I have 2 teens in the home, but when I was, and we've been blessed to be in a very, small, nurturing public charter school. And so
Nice.
I would, and which relies on parent volunteers. So I would volunteer as often as I could, in their classes and go on field trips and their overnight trips. I mean, so fun. And yet, when I was volunteering in their K-1 classes, in their second grade classes, third and fourth grade classes, what was alarming to me were the number of kids who were not comfortable in their bodies or their
Yes.
brains, right?
Mhm.
When I finished residency in 2000, there was no such diagnosis as sensory processing disorder. I mean,
Yep.
sure, we all have sensory issues every once in a while. I can tell you there's a sweater that I wear that sometimes the tag really bugs me, and other times I don't even notice it, right? So we
Yep.
kind of go in and out of these moments, but there's some kids who every moment of the
Live
day
in
they
that.
don't
Yes.
feel good, right? And they're rolling on the floor or shouting out or running around class because they're just not comfortable. And
Yeah.
so um but it was, I mean, shocking to me and sad the number of kids that now we just accept, oh, Johnny has, it takes him, 10 minutes to get on his shoes because we can't tie the shoelaces tight enough. Or, oh, we just know we don't, we don't vacuum or run the blender when Debbie is at home because it just flips her
Yes.
out, right? So we as parents have learned to kind of accommodate,
Cope.
and of course, we
Yeah.
want to help our kids be comfortable, but in kind of creating this bubble and shifting our lives, I've had parents, I mean, just kind of rearrange entire schedules and lives because of their kids' sensory needs without stepping
Yes.
back and saying, "Whoa, okay, wait a second. Life shouldn't
Mhm.
be so hard, right?
Yes.
We shouldn't have to think about, every single sensory concern, right?
Yes. Yeah.
Because someday your kids are going to be out of the home and there's not going to be someone
Somebody to accommodate
creating
like that.
a bubble around them. So and then, the statistics, I mean, now we know nearly 1 in 2 kids has a chronic disease. Probably, I'm gonna say probably more than that because how many kids,
Yes.
have a little bit of eczema who haven't been diagnosed with eczema, but, "Oh, that's a little eczema
Right.
patch, it'll clear," right? At least 1 in 5 kids has eczema, and I remember
Mhm.
when Kenzie was little, a baby, and I was in the mom baby groups, and you're sitting around like some of these classes or you're just sharing. I mean, so many kids with like the rough red patches on their skin,
Yes.
right?
Yep.
Just
Mhm.
scaly and sometimes even bleeding. And, or kids who, were, you know, wheezing every time they got a cold, or when I was in a
Yes.
co-op preschool with them and, we would bring communal snacks, the list of allergens, because so many kids had
Mhm.
anaphylactic food allergies that we had to really
Yes.
be mindful of. And, same thing. I look back to, residency. I never wrote a prescription for an EpiPen. Like it just
Yeah.
wasn't, it was the rare thing. And
Yep.
now, anaphylactic food allergies are on the rise, as is
Yep.
eczema 1 in 5, asthma 1 in 10 kids, ADHD 1 in 10 kids. By the time kids
Right.
are teenagers, 1 in 3 teenage girls is going to have anxiety.
Right.
And sadly, 1 in 3 teenage girls has seriously thought of suicide. So, and we
Mhm.
also know in terms of autoimmunity, I mean, how many of us as mothers, have autoimmune conditions, right?
Right. Yep.
So many women are, 3 times or more times likely than men to have autoimmunity. And we just kind of expect, oh, this is part of the normal. But I'm seeing
Right.
so many girls with Hashimoto's antibodies, and maybe their thyroid
Yep.
looks okay right now. Their TSH is under
Right.
2, but they have really high thyroid
Antibodies.
globulin, thyroid peroxidase antibodies. And so that is, our kids are the canary in the coal mine.
That's exactly what I was just about
Right?
to say.
They are our
Yes.
signal that this world, we are not adapted to live in this world. And
Mhm.
unless we change, what we're doing to this world and what we're producing and what we're eating and putting on our skins, and also adapt internally, right? Building
Yep.
that cellular resilience, microbiome
Yes.
resilience, we're not going to be able to thrive in this world for much longer. So this is our wake
Right.
up call. We need to, it's and the thing is we can do it. I mean, we
Yep.
have the tools and the knowledge, but as you said, I mean, the research doesn't necessarily translate into clinical experience for decades. They said 17
Right.
years, right? But
Which,
we've
yeah, that was
known
gonna be my estimation, 10 to 20
that's right.
years. Yeah.
Well, but when you look back at, I comb through PubMed to see, well, when is the first mention of leaky gut
Yep.
and, a children's health condition?
Mhm.
1981. That's
Wow.
over 40 years that there is a
Wow.
link recognized between leaky gut and childhood eczema. Like, why aren't
Mhm.
we learning this in med school or residency? Right? Why aren't
That's the big
dermatologists learning
question.
this? And so,
Yeah.
and it's not, I will say for many practitioners who are sitting in with this tremendous, weight of guilt on their shoulders, right? It's
Yep.
um it's really and parents too, right? Who are kind of
Right.
looking and thinking, "Oh my gosh, I didn't know
I
that
had
that one
known.
round I
Yeah.
had no idea that that one round of antibiotics could, have tipped my kid over into, allergic
Right.
phenomena, right? Or mental health concerns." And, we have to just, realize, okay, it's through no fault of our own. We didn't know. I mean,
Right.
this was not part of conventional medical training, and
No.
now it needs to be, right? I mean, that's
100%. Well, we are without excuse at this point, in
yeah,
my opinion, to not have it part of our training. Like, I know for me, I didn't, when people are like, "Oh, nurses learn about nutrition and doctors learn about nutrition." No,
no
like,
way.
we no, we don't. Everything I have learned since leaving conventional medicine, I have had to pay for myself
Yeah,
because which is fine. I want to learn it. I want to learn the tools to help people, feel better in their bodies, and address these concerns that we've been trained to accept. And I think that's the thing is that we've been conditioned unintentionally. I don't think it's intentional, but we've been conditioned to accept diagnoses, to accept illnesses as normal, as part of you. Like, this is just how your child is. They have sensory issues. Well, I can tell you, my child had sensory issues after her 5-year shots, and she no longer has sensory issues now. Like, she got her 5-year shots and had some sensory issues, and then that's really what triggered, in my opinion, for us specifically. I'm not saying this across the board, but I'm saying for us specifically, the autoimmune susceptibility towards pandas. So that when
yeah,
she got strep, it was the straw that broke the camel's back, right? And now that we've gone through all of this healing, she doesn't have sensory issues. Like, so it can go away. Like, there are things that we
yes,
can do, like reflex integration, PT, OT. There's so many different things that we can do to work with the nervous system component of our child's health, right?
yeah,
So, but I think one of the harder things is once we move from that place of recognizing, like, okay, I've been conditioned to accept that this thing that just doesn't feel right, like, it doesn't feel right for me to accept that my child's having anxiety or sleep issues or skin issues or chronic diarrhea or these things that parents are coming to us with, right? Of like, they've been struggling
mhm,
with this
mhm,
for 5 years and nobody's fixed it. Um, is to recondition ourselves with our intuition that says, "You know what? It's actually not normal, and there's something we can do about it. So let's
mhm,
find somebody that can do something about it." But one of the hardest places to start, I feel like, is to, again, untangle ourselves from this idea that we can just take a pill or a supplement to fix it.
yeah.
We have to start. Well, I'm curious if you would agree with me, because I would love to be challenged on this if I'm wrong. In my opinion, there's no way to avoid the fact that all of us have to start with looking at our diet and our lifestyle. If we're looking at, if we're looking down the barrel of these illnesses, right, that we want to get rid of. Would you say that that's accurate?
Yeah, I mean, I think one of the things, I mean, there's so many paradigm shifts that need to occur in
Mhm.
conventional and integrative pediatrics. And one thing that I talk to functional medicine practitioners from all walks of life, whether they're chiropractors, NDs, MDs, DOs. health coaches, I mean, you name
Yeah,
it, right? Nutritionists, NPs, RNs. I mean,
yeah,
as we walk into functional medicine and become fascinated by the power of this new way of looking at functional labs and the power of
yes,
botanicals and supplements to, heal leaky gut and to, do um, reduce oxidative stress, support your mitochondria. For we're at a point now where the paradigm hasn't shifted enough,
yep, I
right?
agree.
Because many practitioners are still they have a root cause, different outlook. Great, we're getting to the underlying factors that maybe tipped you or your child into illness, but it's still matching a supplement for each lab that's abnormal.
Which is
So,
allopathic.
yep, which is,
Yeah,
then you're treating the labs, not the child. And
right.
we end up with a list of maybe, 20, 30 supplements. And this is where I started. This is where, as a
Mhm.
practitioner, you
Yep,
start and you learn the patterns. But
yep.
then over time and clinical experience, what you realize is if you don't get back to the foundations, your kids or your adult patients will slide right back. You can get your
Yep,
kids or your patients into quote remission, but without the foundations, it slides right back. So that's
yep.
where, in
Mhm.
part 2 of the book, I talk about the 5 things for microbiome magic. These are the
Yes.
5 things that are the foundation for any gut healing or chronic health healing program. And you have to get back to these 5 things. If we
Okay.
don't, you can throw all the supplements you want at a leaky gut and do, and gut dysbiosis, but you're not going to stay in health. And the 5
Right,
things for microbiome magic, they are the things. And I teach kids and parents and a lot of teenagers like, oh my gosh, I can do this, right? Because we want to make it fun and memorable and
yes,
doable. So when we teach them about these 5 things that we actually already do every day, right?
right.
We learn how to do them in a way that creates microbiome resilience. We learn how to
Okay.
nourish our gut microbiome. We learn how to breathe or regulate our vagus nerve for microbiome resilience.
Mhm.
We learn how to sleep, hydrate, and move our bodies, all with an eye towards how are we living and eating and moving every single day to take care of this ecosystem of trillions of tiny organisms in my gut
So good.
whose sole job is to keep my brain and immune system and me healthy and happy. So it puts
Right,
it in a slightly different light. We're not just eating for, hedonistic pleasure. It is about supporting our microbiome. And when you
right,
do that, it's like creating this fertile garden, right? Where the
right.
good things just want to grow. And so, and your microbiome, because of the ripple effect on your child's developing immune system or brains or
Yes,
hormones or metabolic system is going to have ripple effects on virtually and the gut skin connection, right? Virtually any
yes.
imbalance that's there. So we have to start with those foundations. And then oftentimes a lot of things will fall into place. And then you
Mhm.
fine tune with, targeted blood work. I
Right.
always recommend a functional stool analysis because that is
Mhm.
one area where I might have clinical clues that your child has a zinc deficiency or magnesium
Right,
deficiency, but I can't tell just by looking at your child, do they have a Klebsiella overgrowth or do they have too much
right, or
strep or
salmonella.
yeah, or
Yep,
not enough bifidobacteria or not enough,
yes.
Akkermansia in their gut. You need to look.
Mhm.
And the when you look, there's lots of different stool analyses out there. I love that you use a company that uses shotgun metagenomics. Shotgun metagenomics is really the gold standard for microbiome
Nice.
analysis because it really looks at your child's entire microbiome, every single living organism that we have the DNA imprint for, whether
Right.
it's viruses, bacteria, archaea, parasites, yeast.
Yep,
We
yep,
can identify with shotgun metagenomics. That is the gold standard, not PCR testing anymore.
right.
And also the relative abundances, because sometimes dysbiosis means you don't have enough of the good stuff. Not that there's a lot of bad stuff, right?
Yeah, exactly. Yep.
So that would be, I would say, I 100% agree with you. That's where to start. And I love that, when you were talking about your daughter and you celebrated the time when she had a fever, this is another huge paradigm shift that we
Totally.
need to make. That our body's response to infections, toxins, it's to create inflammation. That
Yep.
inflammation, it is a good thing in that moment. It's
Yep.
inflammation is not good or bad, right? Remember, nothing's good or
Right.
bad. It's
The
just
context.
when
Yep.
we have chronic inflammation. And so
Right.
when your kids have a fever, I have a whole chapter on fever. I have a whole
Yes.
chapter on antibiotics and what we as parents and practitioners need to know. And one of the biggest things that we need to kind of overcome is our collective fever phobia. Right?
Yep.
Because I remember,
Absolutely.
knock on wood, I haven't, been to the ER in quite a while with my own kids, but I remember as a resident when a kiddo came in with a fever,
Mhm.
before I ever saw them, as the resident
Mhm.
or as the attending, they would be given a dose of Tylenol
Totally.
and sent to wait in the waiting room, and then you come
Yep.
in and see them, right?
Yep. These
I
are
mean,
the memories that keep me up at night now.
that's right, yeah.
It's the
Or
I gave yeah, the
that's
Motrin.
right. Or I remember, it was the standard, and it may be still in some
Yes.
pediatric offices,
Mhm.
that every time a kiddo got a vaccine, it was simultaneous with
Tylenol.
a dose of Tylenol, right?
Mhm.
To hopefully prevent, any reaction. So, in the research now in clinically, we know better than that. We don't want to
Yep.
suppress the inflammatory response or the fever, right?
Yes.
But then as a
Exactly.
parent, you don't want your kid at 3 in the morning, high fever, suffering, miserable moaning, groaning.
Yes.
So
Yep.
that's where, my publisher was like, "This your book is actually 2 books in 1, but part 4 goes
Mhm.
through the top 25 most common acute pediatric conditions like fever,
Yes.
earaches, sore throats, vomiting, diarrhea, you name it,
Totally. Yes.
anxiety, sleep problems." And then I share with you the integrative tools. Like, here are my top lists of homeopathic remedies,
Love it.
herbs, essential oils, acupressure points that you can use on your kids. And also, here's when you should see the doctor,
So good.
right? And
Yes.
here's when antibiotics might be needed. And if they
Yep.
are needed, how do you restore your child's gut microbiome so that you can get the benefit of
Exactly.
killing the pathogenic bacteria while also preserving your child's microbiome?
Exactly. That's so good. And that's yeah, I was flipping through that part and I'm like, "Oh man, I can't wait to dive into this because this is literally I was thinking about it today. I'm like, this is literally like the dream book that I would have loved to have had
Oh,
like 10 years ago. And I'm not saying that to like hype you up. I mean this as a pediatric nurse. I have not found anything like this. I mean, I have different like homeopathic books and different herbal books and like family care, holistic, in that like
yeah.
realm, but we all need guidelines, right? We need those
Yes.
like we need to learn how to bull with bumpers. And I think that this book provides that of like knowing when to do the extra. Like I remember my youngest daughter, she had a UTI a couple years ago that hit hard and fast, swimming season. She loves to swim,
Yeah.
and the chlorine just wiped out her flora down there. And it hit very hard and very fast. And I just knew, like, instinctively, this is not it. Like, I'm going to get some herbs on board, but I know, like, she needs a dose of antibiotics this time. And it's okay if you don't know that, but I just kind of had this gut feeling like
Yep.
we've been on this rodeo before, got the antibiotics on board. But at that time, I didn't know specifically like what strains to use to like give at the same time to protect. So she finished that round of antibiotics. UTI was gone, had a little bit of loose stool, but was so grumpy for like
Yeah.
weeks
Yeah.
afterwards. And I was just like, this is not like her. Like she's my sweet, easy, happy-go-lucky kid. Ended up doing some microbiome testing, and sure enough, this is where the PCR tests are garbage because she actually didn't have high amounts of C. diff, but her ratio, the abundance of it in correlation to all the other
Yeah.
good bacteria was high. And C. diff, we know, interacts with the neurotransmitters and makes kids very, very irritable. And so anyway, so that was actually the beginning of me getting like my training and certifications in microbiome testing because it was so useful for us to know what we needed to treat, how to rebound from this, need for antibiotics. And this book is just, it's amazing. And I can't wait to read the rest of it because it's so good already. So if you're listening, make sure to go to Amazon or I think it's on your website too, isn't it?
It is on my website. It's
Okay.
healthykidshappykids.com/book. But I
Okay.
mean, most people buy books on Amazon. It's
Sure.
pretty much anywhere books are sold.
Okay.
So I would either go to my book website, not the main page, but the /book website,
Okay.
and then it'll list everywhere you can find it. But Barnes and Noble, Target
Yeah.
online, Walmart
All the
online,
places you
all the
could
places,
go.
and support your indie bookstores too, right? I mean,
Yes.
I've walked in various conferences into little bookstores, and been so grateful to find a copy on the shelf, like, and
Yeah.
they will also order it for you if you want,
Wow.
right?
That's so cool. I did not know that. Well, yeah, I just cannot recommend this book enough. Thank you for all that you do, Dr. Song. It's a privilege to get to meet you even virtually. And I think I remember just kind of going back to the fevers thing. I remember there was one doctor that I loved working with in the hospital. She was an infectious disease doctor. But whenever the parents would be freaking out about fevers, she would say, "Look at your child. Are they
Yes.
happy? Are they smiling? Are they drinking? We don't need to be afraid." And so I remember like seeing that interaction as a brand new baby nurse. I think I'd been a nurse for like 3 weeks at that point, and taking that on because there's so much, like you said, undoing in that fever theology, we'll call it, that we need to undo. And so I love the tools that you have in this book. They're so practical. I can't wait to dive into it more because I'm working through just a couple little things with my youngest that I need some eyes on. So thank you so much for your time, Dr. Song. I really appreciate you. Any last parting words of wisdom or encouragement for my listeners today?
Yeah, well, I want to thank you for having me on, and I thank you for the work that you're doing, because I mean, we need, it will take,
Everyone.
a village, all of us, to kind of come together. And I think I would say for moms, I mean, it is mostly moms that I work with, but I mean, dads as well. I would say, as a parent, when you have a child who maybe has a health concern in front of you, and you kind of sit back and tell their story in a different way, and you
Yeah,
realize, wow, there's so many factors that, led my child to this point, so many
yeah,
factors that kind of affected their microbiome, and then maybe there was one thing that was the straw that broke the camel's back and tipped them over. I just
yeah,
want parents to know that no matter how old your kids are, even if they're, 18 heading off to college, right? Or if they're young adult kids, it's never too late to restore your
yeah,
microbiome, and it's never too late to set in motion that microbiome resilience for healthier brains and bodies and immune systems, and all of
yes,
that. And so, it may be a longer of a road the
yep.
older you get, but it's all a journey, and it's not impossible.
Mhm.
And I just would encourage you and your kids just to start wherever you're at.
Wow, that's so good, and I fully agree with that, and I think, like you said, going back to the canary in the coal mine, so often what our children are going through prompts us to do deeper work for
Yeah.
ourselves too, right? So if our kids are having to work on their microbiome, we probably are too, and this book is gonna help you with that. So thank you so much, Dr. Song. I really appreciate it, and I can't wait, for my listeners to grab your book.
Thank you for having me.
Yeah.